Assalamu alaikum. My name is Noor Nabi, first year BDS from KMDC, and my presentation is going to be on the effects of smoking. And I'm also going to discuss with you some ways you can quit smoking. And as I am a BDS student, most of my effects of smoking are going to be on our oral health. Okay, so first of all, I'm going to discuss with you the effects of smoking on our health, which are negative. First of all, is the risk of dry socket by more than three-fourths as compared to somebody who doesn't smoke. Dry socket, or should I say alveolar osteitis, can lead to common local complications such as severe prolonged pain, delayed healing, bad breath, foul taste, visible exposed bone, or should I say empty socket. And infection related complications would be local infection of the socket spread, and this infection can spread to surrounding bone. Then, as a research paper suggests, that cancer smoking accounts for over 90% of lung cancer cases in men. Along with that, smokers have about 2 to 4 times higher risk of gum periodontal diseases than non-smokers. These periodontal diseases can be gingivitis or periodontitis, and along with that, smoking is a very bad, not just for you but also the people around you. The same mother who carried you in her womb for 9 months straight might just die from lung cancer, which was birthed by the smoke of your cigarette. Now, regarding the effects of smoking on your oral health, can be tooth discoloration, gum disease, tooth loss, tooth decay, cavities, oral cancer, bad breath, taste changes, stains, cosmetic changes, slower healing, more complications. As after extractions, implants, or gum surgery, smokers have more dry socket infections and delayed wound healing, which was aforementioned in the previous slide. Reduced treatment response, as gum disease treatments and deep cleanings work less effectively in smokers below because blood flow and immune function in the gums are impaired. Now, this is a graphical representation of the frequency of cancers in smokers versus non-smokers. As you can see from the graph, that smokers have 5 times more chances and are more likely to develop cancer than somebody who has never smoked in their life. Along with it is the frequency of dry sockets, as smokers have 3 times more chances of having dry socket than non-smokers. And I've already discussed the complications that arise from dry socket in the previous slides. Now I want you to remember something, that life doesn't exactly have a undo button or a redo button. Once you or somebody you know has cancer, there is no going back from it, and the chances of coming back from it are very low. Stop now before it is too late, because remember, precaution is much better than regret. Okay, so first of all, I'm going to discuss with you some ways you can quit smoking. First of all, is distracting yourself, not even realizing that there is something called a cigarette. Second of all, is seeking help from professionals and family. Third of all, is knowing your triggers and stopping them. And fourth of all is, which is the last option, using NRTs, also known as nicotine replacement therapies, which provide you a stable and a much safer dose of nicotine to help you subside and help you control your cravings. Now, quitting smoking has a lot of benefits, and the benefits are actually quite immediate. Within 20 minutes, your heart rate and blood pressure drop towards normal. Within 12 to 24 hours, blood carbon monoxide returns to normal. Within 1 to 2 years, risk of heart attack falls sharply compared to someone who keeps smoking. And within 15 years, the risk of coronary heart disease is about the same as somebody who has never smoked in their life. Now, I want you to know, when you ask somebody who smokes, it would be mostly because they say it really helps release stress. But somebody who has quit smoking often reports low anxiety, depression, and stress, along with better overall mood and quality of life. And regarding overall health, would be improved circulation, lung function, sexual health, reduced risk of serious illnesses, better oral health, healthier heart rate, blood pressure, healthier looking skin, and more energy. You say you would die for your family, but would you be willing to change for them? Would you be willing to sacrifice for them so that they may live a better life? Now, these are the sources from which I made my presentation. Thank you.